we are going to give it just another minute there to see if we're going to get anyone else joining us live for today's session. The session today is being recorded and we are going to share it on our social media platforms as well as the CFMWS YouTube channel. So for those who aren't able to catch it live, or if you need to pop out early, the recording will be made available probably later today. Actually, we can get that up and posted, but we'll just give it another maybe minute there and see if we get any more people joining us for the live show.
Sounds good, Jackie.
Awesome. I have this giant record sticker on my screen to make sure I don't forget. We'll let that play through there for a minute.
I always forget about the YouTube channel.
Oh yeah, good stuff on there. All right. Keeping an eye on the waiting room there. Or Charlotte, looks like it might just be you with us right now. So you get a one-on-one presentation live today. We will. Two-on-one. So, yeah, true. We will encourage the chat use here and there. So if you're able to communicate through there, that's great. Or you can come on screen if you'd like, or we'll just kind of roll through things as we see fit here. What do you say, Nat? You want to just get rolling?
I'm ready.
Awesome. Okay, everyone. So welcome to the first part of the Mental Health Week 2021 webinar series. So we are doing a two-part series this week, today and Wednesday at the same time. Nat and I will be presenting both of those sessions. So as it is the kickoff to Mental Health Week this week, there's going to be a ton of content going up, sharing different key messages, different links and resources and graphics, all to hopefully help you learn a little bit more about your personal mental health, what you can do to maybe improve it, should that be something you're looking to do. And this year's theme is kind of the Get Real theme, which is all really about getting a better understanding of kind of how you feel, your emotions, and being able to express those constructively and kind of be a little bit more cognizant of everyone's emotions and how those play a huge part in our mental health. So with that being said, we'll kind of just kick things off here with our presentation today. Oh, and that's going to play again. I'm just going to flip over that guy. Oh, maybe I can't. Let's see here. There we go. Technical difficulties. So today we're going to be just reviewing a little bit about mental fitness in general. So I'm sure most folks who maybe attended any of our mental health or stress management, any of those types of sessions, this might be a bit of a repeat for you, but it's always good to kind of just have a bit of an understanding of kind of what mental fitness looks like, and kind of you can apply that to your own, a little bit of personal reflection on that front as well. We're also going to be diving into addressing stigma and its impact. So again, something that might be a little bit of a repeat if you've seen a few presentations of ours, but again, always great to kind of dive back into. And then some of the newer content, we're going to go into a little bit more about understanding our emotions and kind of do a little bit of a kickoff to the emotion and coping section, which we'll be getting into a little bit more on Wednesday in terms of strategies and coping and things like that. And then of course, we'll always share with you some key resources that we always like to refer our members and staff to. So that's what we'll be kind of covering today. Depending on how much we ramble, the timings might change a little bit here, but we'll get through it. We'll get through it today. Okay, so the first thing that we want to always address, and what we always usually kick off a mental fitness or any health promotion webinar with, is really understanding this definition of health. So again, this is probably something you might have seen before, but if it is new to you, we really like to share this kind of holistic approach to kind of the definition of what health is really. So we're looking at that state of physical, mental, spiritual, and social well-being, and not just merely the absence of disease or infirmity. I'm going to give you guys a heads up here. I just got internet unstable connection, so if I drop here, not you're up, but hopefully we'll get through it. So again, as I mentioned, this is really kind of that holistic approach to health. So not merely looking at your ability to go and run 5 kilometers this afternoon, or maybe how well you feel emotionally in this present moment, but kind of putting everything together and looking at many of the factors that do influence our overall health and wellness. When it comes to kind of what we teach, we really do try and touch on all aspects of these to ensure that we are kind of providing that full, well-rounded scope of improving your overall health and well-being, and not just focusing on kind of that potentially outdated view, which I know Nat will be speaking to a little bit later, of just either being sick or being well. So we'll get into that a little bit more. And on the heels of that, this kind of leads into our discussion today of what mental fitness really is. So I know we do only have one person on the line here, but maybe what are some key words or things that kind of come to mind when you think of being mentally fit or mentally well? What are maybe some things that you think about or kind of come to mind when that word kind of pops up? Yeah, maybe a second there to add something in the chat, and if not, we'll just keep rolling. Being happy, absolutely. So really, we're going to be looking at kind of that emotional resilience, and I know that word is probably going to come up a little bit more as we go along here. But really, when we're talking about kind of that being mentally fit or mentally well, we're talking about that state of well-being in which an individual is psychologically and emotionally resilient. So really being able to take on a situation that they might have struggled through, and exactly that, able to cope with various situations, right? So really kind of dealing with a situation maybe head on instead of maybe burying or not dealing with those emotions, which we'll get into a little bit later. But really being able to kind of bounce back and take maybe those stressful or those hectic moments or times in your life, be able to kind of learn, grow, and develop from those, and be able to kind of use those skills or those strategies that maybe were effective for you for future situations. And maybe that's going to be able to help you kind of navigate that situation a little bit better as it might present itself again. So really that resilience is that kind of key piece here. And this is definitely something that we have to practice. It's not something that kind of just comes naturally to us. For some, it might be easier than others, but that's kind of where we get that term kind of fitness from. We kind of like to relate that mental fitness to physical fitness, in the sense that it's something that we have to train, we have to work for, we have to be consistent with, and really try and ensure that it's not something that we put to the wayside and then have to kind of really struggle to get back to. We want that to be something that's consistently there, and we're able to kind of use those strategies and deploy them at a moment's notice when we need to. So again, it's a term that we use quite often in our programming. And really, it's something that we really want to make sure there's an emphasis placed on, equally as physical fitness, right? So that's kind of where that comes from there. And last thing here, before I turn things over to Nat, I'm sure we could probably think of many reasons as to why our mental fitness is important, or why we should use different strategies to practice it, or explore different coping mechanisms and things like that. When we're speaking pretty generally here, obviously, when we're looking at people who are mentally fit, mentally well, we're obviously going to have less mental health issues and physical illnesses. So the link between our mental fitness and our physical fitness is very real. So we obviously see that connection there. When we're talking about kind of that well-being in general, positive attitude, you're socially healthy, you have kind of those social interactions, you're enjoyable to be around, and people appreciate that maybe. And you just generally kind of feel well, and things are going okay for you for sure. And then lastly is performance, right? So this can kind of have varying iterations depending on kind of how you look at it, but being able to perform both professionally and personally. So being able to meet the needs of work and probably the 15 other hats that you might wear outside of being an employee. So mom, dad, caregiver, coach, spouse, whatever those might be, being able to perform and fulfill those roles to meet your satisfaction as best as you can. And obviously being mentally fit and well is going to be able to allow you to hopefully navigate all of those roles and do so in a way that's going to be effective to you and everyone that's around you. So those are just a couple of obviously the key things there. There's a ton more reasons why mental fitness is so important. We'll probably be touching on a few of those throughout the presentation today, as well as Wednesday as well. But just wanted to give a quick kind of intro and an understanding there before we maybe get into a little bit more of the nitty gritty today. So with that being said, I'll turn things over to you, Nat.
Perfect. Thanks, Jackie. Let's look at obviously what we're looking at on the screen here. Talk about an old view of health, the outdated view of health. And I like starting off with this right before we get to the mental health continuum model, because it shows us more or less where we have come from. And funny enough, it's not that long ago, right? The mental health continuum model, let's just put it for ease, is probably about a little less than 10 years old, right around 10 years old. So not too long ago, it was more or less looking at health in these terms, right? Green or red, healthy or sick, fit or unfit, functional, not functional, productive, unproductive. And we obviously know that this is kind of an unrealistic view of where we're at today, or any time really. It's very much too black or white, one or the other. And we know there's a lot of gray in between. So again, this was an old view. Let's move it up to a little bit more of a realistic and present view. And that's the mental health continuum model. Again, we use it specifically to look at mental health, but as you can see on the slide here, with it being the health continuum model, you can use this really kind of throughout. And it has now, we'll say, separated or pushed apart the green and the red and added in the gray, if you want to look at it in black or white type of color schemes. If you want to add the color, we're looking at yellow and orange. So again, we've doubled the amount of categories to allow us to recognize that we are not one or the other, that we are constantly flowing throughout this model. Even if we think about ourselves at different points of our lives, or even what we've been going through in the last short term, the last year and a bit, we've probably gone from green, maybe not all the way to red, but we've certainly been in between, if not kind of stuck in that middle zone. So the mental health continuum model describes behaviors, specifically looking at changes in behaviors from one category to the next. It focuses on behavior so that anyone can really recognize those changes in ourselves, in those around us. And of course, when we're able to recognize, we can take action and take the appropriate means to help us typically head back towards the green. So let's talk about the continuum a little bit. So of course, the green, this is when we are productive. when we are fully functional, strong, healthy, engaged. This is the ideal situation. However, we are free flowing throughout this model all the time. So increase the stress a little bit, whether that's change in responsibilities, whatever the case may be. Stress increases, we can easily find ourselves in the reacting in the yellow. I can't quite read it, but I believe it's common and reversible distress. It's described as. So again, once we find ourselves here, for the most part, we take time for ourselves. We do things that help us maintain, improve our mental fitness, and we find ourselves back in the green, back fully functional, ready to go. Happens regularly. For somebody that could be weekly, monthly, bi-weekly, could be daily. But again, we find ourselves back in the green regularly and often enough. Now we increase stress a little bit more, maybe one large stressor in life. We move further down the continuum, make it to the orange and the injured. Here we have, again, a little bit more persistent functional impairment. And again, if we make it further down the continuum, a little bit more of that clinical disorders and severe functional impairment. The further we make it towards the red of the continuum, the longer it can take us, for the most part, not all situations, but the longer it typically takes us to get back towards the green, and the more use of resources we would require. So that's a little bit on looking at the model. Now, I kind of like to look at it a little bit differently with not necessarily specific examples, but perhaps a little bit more common situations. So I kind of described a little bit of increasing stress. So increased stress, we find ourselves in the yellow, no problem, right? We find ourselves back in the green fairly quickly and fairly regularly, going back and forth. However, if we do not look after ourselves, or perhaps avoid dealing with some of these stressors, we could find ourselves staying in that yellow a little bit longer. When we start to stay in the yellow a little bit longer, and again, we slightly make it back to the green, and perhaps every so often, but then we're right back in the yellow. That eventually can become kind of the norm for somebody. And now we think that our green is a little bit more looking like our yellow, and we're staying there more often. And of course, if we're staying in the yellow more often, stress is not going to necessarily just go away unless we're taking a little bit of action on that. We can start to find ourselves dipping into the orange a little bit more, and then making it back to the yellow. And of course, with that being said, a little while passes and we're finding ourselves a little bit more in the orange than simply in the yellow. So that goes to show a little bit how we can kind of not recognize some of the small changes that eventually push us down the continuum, staying further towards the red a little bit longer. And of course, we can kind of go on in this. So what the campaign this week is really looking at, and what the continuum is pushing for, is for people to become more aware of where they are with regards to this continuum, and or with regards to their emotions. So again, the campaign specifically looking at understanding our emotions a little bit more. We'll get to that shortly, but again, this is probably an area that we are not so comfortable with and are very good at expressing our emotions. So something to think about and to consider, and what I encourage people to do with regards to this model, and now we're going to kind of fine tune it with regards to emotion, is to really kind of pay attention to where we're at. And if you find yourself in the yellow a little bit more, recognize that, identify it, be able to name it as you're going to hear throughout the campaign. And that will help you be able to take action to get back towards the green. If we simply say, I'm just off right now, it'll be fine next week, chances are, unless you take that little bit of action, you're going to be staying there in the yellow and again, shifting a little bit further on. So that's a little bit on kind of that model. And if we talk about emotions specifically, again, we can look at this in all kinds of different ways, and it will be different from person to person. But let's just put it kind of easily out there. So in the green and the healthy, somebody's a happy, uses humor kind of appropriately. Perhaps when they find themselves in the yellow, they're maybe a little bit more irritable and not using humor as they once did over in the green, maybe a little bit more sarcastic, for example. Come the orange, now perhaps you're seeing a few angry outbursts that are kind of out of the norm. And then finally in the red, for example, somebody could now be angry a little bit more or frustrated, not in certain situations, but most situations and with most people. So that's a quick example of how we can look at changes in our mood, in our emotions, from healthy to ill. And like I mentioned, that's just one example. It would be different from person to person, depending on what they look like in the green, because that will, again, be different between everyone. So that's a little bit on how to use the continuum. What is key with it is that someone can recognize where they are and changes within their behaviors, within their mood, within their attitude, etc. And once we are able to recognize those changes, we take action to help us get back to the green as soon and as early as possible. We don't want to wait till we're further down the continuum. So again, we can use this for ourselves and also with those around us. Next slide, please, Jackie. So let's talk about this now. So what stops anyone, CAF personnel, civilian employees, family members, anybody really, from seeking assistance when they may perhaps find themselves a little bit further down the continuum? So I'll have you write down a few different answers in that chat there, Rochelle, if possible.
Putting you on the spot here a little bit today.
Yeah. Stigma. Yeah, absolutely. And I'm going to push just a little bit further on that because I'm going to expand on it. But what would be some examples of how stigma would impact somebody from not seeking help? What are some things that perhaps we do in our society that really keeps that stigma around and going? Can you name me some of those? Push a bit further. Yeah, so you've named every reason why somebody might not come forward, right? Fear of consequences. Here you've mentioned their employment. Yeah, absolutely. Afraid that others may not understand, right? People don't want to be judged, labeled. So that's all part of that that stigma. You're absolutely right, and thank you for sharing that. Another few reasons I have here that people wouldn't come forward is that perhaps they don't know where to go, what to do. So again, we're going to help identify some of those different things today and on Wednesday. And the last one I have on here is kind of that denial. And I gave a good example of that throughout the model. Sometimes we may be the last person to recognize where we are in that model because we are, we'll say, slightly or slowly moving down that continuum. Whether it could be monthly, for example, slowly moving down that continuum and not recognizing those small little changes that, yes, I'm more in the yellow, I'm more in the orange now than I am in the green. So again, that denial piece. So again, we may not want to, we may not recognize it, or we may not want to face it. And that's something that we're going to be discussing here with regards to wanting to recognize and face our emotions with the campaign's theme this year. Perfect. So let's expand on stigma a little bit. So you've given a few examples, but here is more or less a definition of stigma. It's a mark of disgrace associated with a particular circumstance, quality, or person. And here we're specifically looking and talking about the stigma of a mental disorder. And you gave some examples on how that impacts or how we kind of bring that out in our society. And we do that in really two ways, through different attitudes and then behaviors. So even if you, perfect, thank you. Attitudes and behaviors, so that's exactly it. So if we have negative attitudes about whatever the case may be, here we're talking about mental health, chances are they're going to show in our behaviors eventually. So negative attitudes with regards to mental health, or some of the different things we see, some of the common behaviors, attitudes out there. And maybe I'll ask you, Rochelle, how about in the chat, can you name some of those attitudes that some in our society may have that would kind of bring out stigma, bring out our behaviors? What would be some attitudes that are common around mental health? Anger, yeah. Fear, absolutely. Very good. So again, anger, right? This, you can look at this in many different ways. If people, and the ones that I have here are, we can't see it. We don't see anything wrong with individuals. So what's going on, right? Are they just lazy? Are they faking it? Are they unstable? These are some of the different attitudes that people can have. And we're going to get to some of the reasons perhaps why and how to break this down. Can bring out some of these other emotions that you've identified, right? Angry that why am I having to pick up the slack, perhaps, right? Because that not understanding the entire situation. Unsure how to help, perfect, right? So if we are unsure how to help or afraid we're going to make things worse, what are we going to do? What's our behaviors going to be? It's one of my points here. Chances are we are going to avoid, we're going to ignore, and then that's not going to help the situation at all as well. So very good. So those are some examples of how some negative and unfavorable attitudes can impact, or that we can have, and can obviously impact our behaviors, right? So again, ignore, isolate. I've got here gossip. So if we don't know what's going on, chances are we're going to be asking questions, doing different things that are probably not in the best way to help. So again, these are different ways on how stigma can impact our society, our environment. Let's talk about some consequences of stigma. So again, here you can see a short list, and I'll say short because again, we can really look at some consequences in different ways. But the number one reason, and you identified it earlier, that people won't seek assistance is because of that stigma. Whether it's personal or professional. And what that really means is somebody won't reach out to a friend, a colleague. They won't go see professional resource because they don't want to be labeled, judged, etc. And social isolation. So we touched on that as well. So if we're unsure how to help, not sure what to say, chances are we may start to avoid the situation, avoid the individual. And of course, that is not going to be beneficial to them. And with that said, the individual is going to recognize that, and they are going to start to withdraw and isolate themselves. Impact on career, underemployed. So this is another area that's impacted, and it's kind of twofold. So one, if employers, if supervisors are underutilizing individuals for whatever reason, fear, not sure how to properly utilize, employ that individual, or how to help, again, chances are the individual will not push for those different advancements and not be given the opportunity to get those advancements either. So it's kind of twofold. And that falls into the next point here. So low self-worth, low self-esteem, hopelessness. So if that individual does not feel confident about themselves, they will not be trying to push for that career advancement as well. And that low self-esteem and low self-worth, hopelessness will kind of overlap everywhere. Relationships, friendships, not only in the career path. And the last point on their impact on families, stigma by association. So if there's a member at the unit who is kind of being avoided, not being invited to certain things, that is going to impact, of course, the rest of the family who is not being invited to those unit outings, not being included for certain things. So of course, there's an impact not only on that individual, but on the family as well. So that's a little bit on the consequences of stigma. Let's bring up our next slide, and it's going to look at how to reduce stigma. And you can see all kinds of different ways and different techniques here. I'm not going to go through them all in detail, but I'll highlight a few. We talked about attitudes and behaviors. So being aware of our attitudes and behaviors, try to ensure that our attitudes and behaviors are supportive and inclusive and not perpetuate stigma. You can see some of those points up on there. And if we're able to do that, we are able to choose our words carefully, right? And by choosing our words carefully, can encourage people to be open about talking about mental health and different things like that, and not do the absolute opposite. If we are using words that are not supportive, people are not going to talk about this, are not going to reach out for help. We need to be open to discussing this, and of course, support and be inclusive. And even if we bring it right back to the campaign of Mental Health Week. So again, it's an annual campaign that is gauged on doing exactly that, allowing and encouraging people to break down that stigma, making people aware that it is okay to have these conversations. The theme this year is to understand our emotion, and reading through some of the material. And it's not the first time it's been really brought up, but even by how we respond to people. How you doing? Typical answer, oh, I'm fine, right? And that's a prime example on how we don't even divulge into whether we're feeling happy, whether we're feeling frustrated, angry, whatever the case may be, sad, right? We simply just kind of go through the motions, living on autopilot, and simply say fine, so we can move on to our to-do lists and get back to whatever we need to get done. But a great point on, even if we eliminate saying fine and really say how we feel, we'll start to help being able to discuss our emotions, express our emotions a little bit more effectively. So with regards to stigma, again, we are the ones, our society are the ones that have created and built this stigma. We are going to be the ones that are going to break it down as well. And by simply answering that question, how are you doing? Open and honestly will be a way to allow that to happen. So there are many different things that we can do on an individual basis that can really help reduce and break down stigma. Being open to talking about this. Seeking assistance and encouraging people to use the resources ourselves and themselves is a way to help break down that stigma. So yeah, it's a little bit on reducing stigma, and the campaign talks about it in great detail. I think that's all I had for right now on that.
Awesome. Thanks, Nat. So let's jump in and talk a little bit about, I'll just check out the. Absolutely, Rochelle, you kind of hit the nail on the head there, right? If we're able to be that person and really break down as many barriers as we can and encourage that person to seek assistance, or even if they just need that conversation, right? And you're able to be that ear for them to just maybe voice their emotions in a safe place. That's a huge step forward in kind of breaking down that stigma and encouraging people to be open and honest. And that's, I think, where we can be of assistance as well. And if we're noticing that an individual might be working their way across that continuum, or they're clearly in a space, we're able to provide that assistance if it's needed and welcome, or at least guide them to kind of determining that they might need assistance on their own, right? Which is great. So I think like this campaign in itself is a great one, and there's multiple ones throughout the year. I mean, like Let's Talk is another huge one, right? Where we're kind of looking at the same thing and breaking down those barriers and that stigma, and really just trying to make all of this in terms of seeking assistance and mental health just a normal thing that we would do if we got a cut on our finger, right? Like the same kind of concept. So yeah, I mean, just talking is really kind of that first step that we're usually pretty good at, but it's how we choose to do it and or be the ear and just listen on the other side of the spectrum, right?
I think
Go ahead, Nat.
I think that's key too, right? And maybe I didn't get into enough detail, but if we are open to having those conversations and encouraging them, that's how they're going to happen. Chances are we have to be the ones open enough and be aware enough to make someone else want to discuss and open up with regards to their emotions. Because again, if we're just saying we're fine, what's the response we're going to probably get back when we ask how they're doing? Probably the same thing, right? And of course, we don't have to say, we can share the whole full range of emotion that you're going to discuss. It doesn't always have to be certain ones, right? Good.
Absolutely. I think you hit the nail on the head too earlier. We operate in autopilot a lot of the time too, where we're just walking by someone and it'll be, oh, hey, how you doing? Oh, great. Oh, like good. And then you just carry on, but we're not really willing to stop and maybe have that 10, 15 minute conversation. And yeah, we're so busy. We don't necessarily want to take that time to listen or have that time, quote unquote. I mean, at the end of the day, we really should be prioritizing that human connection above everything else. But again, it's that society that we live in. It's all, fast-paced deadlines, meetings, timings, all those types of things. But it's challenging, and we're kind of butting heads with kind of those societal expectations and what we really need to do to ensure we can have those human connections and break down those barriers and really get to really talking openly about all of this stuff. So as much as we need to get that stuff done, if someone is walking by and maybe you know them and they're just maybe looking off, maybe it is time to take that 10-15 minute conversation, or say, hey, let's go grab, we always say that let's go grab a coffee and chat, right? I think we're promoting caffeine addiction, but it's just kind of that openness to want to have that conversation and be that ear, right? So that's really kind of the first step there. Getting a little bit into kind of this understanding emotions a little bit more. So the next few slides, Nat and I will kind of go back and forth and just talk a little bit about some of the stuff that is probably maybe known, but we dug into it a little bit more. And it's always nice to kind of share a little bit more about it. And this is kind of the key points from the campaign this year. So really trying to be more cognizant and recognize our emotions in general, and maybe what influences those, right? So are there situations or circumstances that maybe trigger certain emotions? And really the campaign is really trying to look at discovering how those may influence how we act, how we feel, our behaviors, our actions, all those types of things, and really trying to learn from those and recognize that those emotions are okay. They're all part of this kind of spectrum of our of regulating all of our emotions. And it's okay to be sad or be angry or be fearful if we're able to kind of recognize that and maybe learn from that, but being able to recognize things as not necessarily good or bad. And I'll get into that in a little bit here, but trying to focus more on that kind of emotional self-regulation. So being able to identify that emotion and put a name on it. And I think that's kind of what the kind of tagline is, right? Like, it's let's get real about how you feel. So what are you feeling? It's not just, oh, I don't know, I'm just kind of down. Like, no, I'm frustrated about this situation, or I'm saddened by things that are going on, and being able to kind of put a name and pinpoint that and be able to kind of learn from that and dig into that a little bit more. And maybe you can place that kind of on the spectrum and be able to figure out what strategies you might need to deploy to get yourself back to maybe being in that green, happier state, but recognizing and kind of living in that emotion for a few minutes or for however long it might be, and doing so constructively in order to kind of get yourself to a place where you can recognize and you can act and then deploy strategies to be able to handle those emotions. I think now's a good time, Nat, if you want to maybe just go into kind of those components there of our emotions kind of quickly before we get into kind of the good versus bad in a few seconds here.
Sure. So on Wednesday, we are really going to get into a little bit more on some of the skills and tools that the campaign talks about on how we can benefit from expressing our emotions. But I thought it'd be a good idea to kind of get into the kind of the foundations around emotions, because again, it's an area that it's been identified that we don't really kind of know too much about, and we are not very good at expressing our true emotions. So a few things that I came across that I found that I thought was important to discuss today. The first thing was really why we have emotions. So I found this fairly interesting. The first, I should say the first, but I'm going to cover three kind of basic ones here. But the first is for survival. So when we feel scared for our lives, when we feel hungry, we take the necessary actions to take care of those needs for survival. So again, that was the first one. The second one was for motivation. So again, our emotions motivate us to do certain things that we enjoy in order for us to experience those comfortable emotions. And our emotions also motivate us to avoid certain situations or certain things that that we don't like doing that lead us to uncomfortable emotions. So again, we have emotions to motivate us to do certain things and avoid certain others. And the last one that I found fairly interesting was that, of course, we have emotions to help with relationships, with friends, with family, and with simply everyone else in our society. So we will express our emotions with people, and we will communicate them in a certain way so that people will continue to do things that we are comfortable with, that we are in line with, that we can relate to. And those keep our friendships strong and going. And on the other hand, our emotions dictate to us when somebody has perhaps crossed a line and we do not appreciate that action or that behavior. And that leads us, if we are dealing with our emotions well, to problem solving in order to maintain and nurture that relationship. If we don't want to continue on, again, then that seems to be indicative of us to no longer be motivated to have that relationship. So again, we're taking necessary steps in that way. So again, it helps us with our relationships and also helps with regards to our society running smoothly. I found that fairly interesting. Next area, and I think it's important to have this foundation before we move on to how to effectively express our emotions, are the different components of an emotion. So again, it was identified that there are three different components to an emotion. The first being the subjective component, and that's more or less our feeling. Are we happy? Are we sad? Are we mad? Are we scared? So those are kind of the subjective components. Second part is how our body responds, and this is known as a physiological component. So do we clench our teeth, clench our fist, sweat a little bit more, heart rate increase, etc. So this is the physiological response that our body does when we are going through an emotion. And the last part is our behavioral response, a behavioral component. So what actions do we take, or perhaps what actions do we not take when dealing with that situation? And I think these components are important because if we slow the process down, it will help us become aware of why we are reacting in a certain way. And we can, of course, change that if we are more aware. And we'll get into that a little bit more on Wednesday. So I think I'll leave it at that. Should we be a little bit more aware of our emotions and we are able to name and express them, there are, of course, benefits. It's been identified that if we are able to discuss, name, express our emotions, that the intensity of those uncomfortable, those negative emotions are less intense and that they are more manageable for us. The stress level is lower, our fear, our anxiety in those situations are lower. And with all that in place, we feel more in control and we are more able to kind of deal with and handle those situations when we are in touch with our emotion. So I thought that was all fairly interesting and a good kind of foundation before we get into the reasonings and how to understand and express our emotions.
Absolutely. Thanks, Nat. I think we often will kind of go maybe that first step or maybe even the second step of I feel this way and I'm feeling it because, but we might not, because I'm recognizing I'm clenching my fists or my face is red and I'm like amped up, but we might not kind of take it that step further. So I think really trying to have that foundation of being able to recognize and learn from that is really that kind of that first step there. And I think that kind of gets into or leads into kind of this next slide here about can feelings or emotions be kind of quote unquote bad or negative. And Rochelle, your kind of comment in the comment box there. I mean, I think thank you for sharing. Like this past year has probably been one of the biggest roller coaster rides of emotions for most people, and having to deal with so many changes, so many unknowns, so many things being thrown at us left, right, and center, and just like everyone kind of fumbling through these changing times, and people are probably feeling a lot more stress and probably dealing with a lot more of maybe with these kind of quote unquote negative emotions. And I'm sure a lot of us can kind of think of or identify certain emotions that we might view as bad or negative, maybe things like anger and sadness, fear, guilt, just to name a few. And they probably are viewed this way because of the circumstances that have kind of either led to them or maybe led us to feel that way, or maybe the emotion, how it's physically displayed in us is something that we might not, it might not be always associated with warm and fuzzy feelings, right? Like if we're crying or if we're really frustrated and we're kind of maybe self-isolating, those are kind of things that we might not look at as necessarily quote unquote positive displays of emotion. But what we're really wanting to get at here is we really want to try and kind of identify the reality is that we need to try and accept these emotions as part of kind of that spectrum of human behavior in order for us to, again, better learn to handle and kind of cope with them rather than trying to kind of bottle them all up and hide from them so many times, right? I think as a societal norm, it's kind of put a cap on it and just kind of shove it down inside of you and don't deal with it because it's not necessarily a comfortable or pretty time, or maybe you're dealing with something and you automatically might kind of come to a boiling point, and that's what's really going to happen here when we're trying to kind of bottle and suppress all of these different emotions. Yeah, absolutely. Like I think some of these things are forcing us, some of these situations or scenarios are forcing us into a place where we have to express our emotions, and we're kind of almost forced into a place where if we don't say how we feel, then things aren't going to change, or things we have to implement different strategies or implement a plan. And I think that's really what we're trying to kind of get across here, is if we're able to kind of clearly identify these feelings and emotions and identify the root of the problem, or maybe not necessarily the problem, but the situation that's leading to them, we can develop that action plan and really try and develop what we need to do in order to effectively deal with those kind of situations or scenarios, so that we might not be forcing this uncomfortable emotion upon ourselves or others for a prolonged period of time. Just a couple kind of myths and facts that I did find on as kind of some of the resources for the campaign this year, just about kind of these negative feelings or emotions, right? A lot of times we have the opinion that it's better to suppress than express. So those negative feelings we often will just kind of shove down, like we said. And as I kind of mentioned already, this is typically what's going to backfire on us, right? If you kind of think of us as something that's corked and we're just shaking it and it's carbonated, eventually it's going to blow, right? So if we're able to recognize that we're upset or we're feeling down, it's much more effective rather than kind of pushing them away to really try and verbally express them or seek assistance or very clearly and constructively be able to deal with those. Unfortunately, a lot of studies show that people who are kind of suppressing those emotions will often turn to negative coping strategies, right? So things like alcohol, drug use, even like stress eating, those types of things. I think a lot of us are guilty of feeling super stressed and reaching for a comfort food, right? In terms of like that feeling of anger, that can sometimes be a very unhealthy, there can be a very unhealthy response to that too, right? That might kind of manifest itself into a much worse situation should it not be able to kind of be identified and handled before you might kind of get to that peak. If you've ever taken our managing angry moments course, we often refer to things as a mountain, right? So if you're working your way up, eventually if you get to the top, things might not be expressed in a constructive or healthy way, right? So trying to express rather than suppress is kind of the key for some of this content here today. Just a couple other ones too that I thought was kind of important. There's a kind of the myth that being sad doesn't really serve us a purpose, or crying is not coping. It's just kind of it just happens. Really, we kind of see sadness as maybe undesirable or a problem emotion that really doesn't benefit us. But in reality, it can be something that might trigger that thinking of changing behaviors or maybe dealing with a situation, as Nat mentioned a little bit earlier. And it really is that healthy way for us to deal with or process the experience of loss, right? I mean, this past year, just for example, we probably had so many things that we lost in terms of maybe kind of our social circles, our seeing our family and friends, maybe jobs, all these types of things we could be very much dealing with that sense of loss, and feeling sad is okay. It's how we're going to be able to kind of cope and deal with that, to be able to, as I mentioned earlier, kind of come out of that and build upon that, and kind of move forward. Absolutely, if we're dealing with kind of it appropriately, it becomes sad or unhappy versus angry, right? We can kind of manifest those emotions and turn them into maybe something that is more constructive, and we can learn from, right? And I think that's really kind of what all of this is kind of getting to, is being able to first kind of recognize, label, and then be able to learn from and use those emotions in that constructive manner. So kind of basically what we're looking at, bottom line here, is that all of our emotions, the entire range of them, is all part of that whole spectrum of human feelings, and it's totally justified to be feeling a certain way, whether that be happy, angry, sad, fearful, upset, guilty, whatever that might be. Those are all valid emotions and are gonna, if we allow them, help us to kind of develop and grow into turn them into something hopefully positive, productive, and build that resilience that we spoke to earlier on in this section. I think I pretty much spoken to this slide as in some of my rambling there, but basically what we're looking at here is, again, if those emotions do though become overwhelming or persistent, or maybe, as Nat said at the beginning, you've kind of manifested yourself, your normal is now in that yellow, or maybe your normal is now in that orange on that spectrum, maybe it is time to seek some assistance. If things are affecting your daily functioning, or you're not able to concentrate and get things done, and maybe you are trying to wear so many hats and you're not able to kind of fulfill those duties for all of those, maybe it is time to seek out some additional resources and support, and that's okay too. We're only human. We have a finite limit of what we can stretch ourselves to do, and I think hopefully we're as a society kind of getting to a place where we are more able to ask for assistance and ask for help, and it's not going to be so negatively looked upon, and we can kind of come to terms with we do have a limit of how much we can do, and sometimes we need assistance, and that should be okay. But definitely seeking that mental health support is nothing to be ashamed of, and it should be something, again, that is strongly encouraged. The last little bit here is really just kind of the wrap up of kind of this foundation presentation today. As we said, hopefully we'll be getting more into, not hopefully, we will be getting more into some of those coping strategies and things like that over the session on Wednesday. And Nat just shared with you the link to our CAF Connection page for a whole bunch more resources in terms of kind of seeking out additional supports. And we do also want to let you know that we are running a kind of a little contest this week. So it's kind of a bit of a self-reflection tool. It's completely anonymous, but it's just an opportunity for you to do a bit of a check-in for yourself and kind of see how you're doing, and hopefully maybe learn a little bit more about yourself and your kind of current state here. And just by doing it, it's a completely kind of separate entry, but you can actually enter to win. I think it's a Sport Check gift card, Nat, if I'm not mistaken. So. Just a little bit of encouragement, maybe go check it out. And it's just an opportunity, again, to kind of dive into learning a little bit more about yourself, your emotions, and kind of where you're at right now. Now, anything else you kind of want to add before we wrap things up today?
No, I liked your tagline. I'm not sure if you saw it somewhere, but I think I caught it there. Express it, don't suppress it.
Yeah, there we go. I'm gonna make a song about it. No, it was totally on their website. I can't take any credit for it.
I didn't recall seeing it, but I'm like, oh, that's catchy.
Good stuff. So, sorry, go ahead.
I didn't quite mean to put the resource up there so quickly, but yeah, everything as you mentioned is right there on our CAF Connection webpage. It will get you to these resources that you see now on the screen, the contest that Jackie mentioned, as well as the Canadian Mental Health Association's campaign webpage.
Absolutely. So yeah, we encourage you to check that out. I think this whole list of stuff is on the website as well. So if you do need any resources or additional content, check it out. And as we mentioned, this was part one of our two-part series. So if you want to join us again on Wednesday at 11 o'clock, I believe it's the exact same Zoom link. So hopefully if you're able to access this one, you can join us again then. It will be recorded as well and shared, but we'll kind of leave it there for today. We'll be getting in, as we mentioned, to more kind of coping and a little bit more about the emotions and a little bit more depth. So dealing with that a little bit more. So with that being said, I guess we will see you on Wednesday. And as always, if you have any questions or concerns, please feel free to reach out to us, boardandhealthpromotion@gmail.com. Awesome. Thanks, Rochelle. We'll see you Wednesday.
Thanks, everyone.
Bye.